So this is my partner in crime, Lloyd Clark, fellow member of the Retina Society. We've been working together on trials for a long time. Truly one of my best friends and trusted colleagues. He's got a couple of patients here to show us how this fancy new technology works. Lloyd, can you hear me?
Yes, good morning.
All right, so with no further ado,
and I can hear myself in the background, so that's a really good sign.
Good. There is about a 2 or 3 second delay. See, so like we're going to see. So, but Lloyd, why don't you?
Dave.
Why don't you go ahead and get started, Lloyd?
Okay, great, Dave. Thank you very much for the invitation, and good morning to everyone. Fortunately, it's not quite as early here in South Carolina as it is in San Diego, but I appreciate very much your willingness to get up and come see our show this morning, which I think is really interesting. I echoed Dave's sentiments about the Navilas laser. It really is an amazing device. I think it really shouldn't even be called a laser. I'm not sure exactly what the name of this procedure should be, but it's so different than our typical experience with thermal laser photocoagulation that we're really in the process of relearning how to do laser, and I think doing it in a way that's superior to what we've done in the past. So this morning we're going to start with a live laser procedure, and I think this is going to go very well. Our first patient is a 60-year-old female who has insulin-dependent diabetes. I saw her just about a week or 10 days or so ago for her initial visit. She has new onset proliferative diabetic retinopathy as well as diabetic macular edema. She now has center-involving diabetic macular edema with a central retinal thickness of 342 microns. She's received no previous treatment for either her diabetic macular edema or proliferative disease. We're going to do PRP on her in a week or two, but I thought this was an excellent case because one of the things we've learned over time is to be very careful with extensive macular laser in eyes with ischemic retina, and this is a case where we're going to do just navigated, very localized laser treatment of microaneurysm. So I think we'll get started. I'm going to go over to the screen now, and what we've got loaded in already is the initial treatment plan for the Navilas laser. Essentially what we do is we come in and we overlay the fluorescein angiogram image to a color image that you see in the background. It's actually taken in a camera by the actual laser itself. And then once that's registered with a number of different navigation points, essentially we just line up the crossing points in the various blood vessels. We're ready to do the laser scan, the laser treatment plan, and you can see a number of green circles on the screen already. That's right, and I'm going to show you how to do just a few before we get started, but I've also added these two no-fly zones here, one over the fovea and one over the optic nerve as well. So I'm going to add the last few spots, and essentially in the plan mode, you just use a mouse to add treatment over just a few microaneurysms. So you find the microaneurysms, and you basically just click on them, just like point and shoot here. And so we're just going to add the last few. And I think we're about ready to go. Actually, let me trash that one. If you don't like what you got, you can just hit the trash can. Okay, great. So now we're going to go to treat. And we are in the treatment mode. We can go ahead and turn the lights down. I'm going to turn the intensity of the infrared up a little bit, and we're going to go to treat. So what we're going to do is basically just find the pupil here, and I'm going to focus into the retina, and you're going to see. Actually, let me get to single spot for focal. I had it in the PRP mode. So let's go ahead and focus in here. I'm going to say, I need to drag this up. Is that right? Show me what I'm doing.
Just put your green arrow.
All right, and there's my treatment plan. So we're going to get started now. And the first thing we're going to do is just titrate the treatment effect. So we're going to start at about 50 microns. We're not quite there yet, so we'll move it up just maybe to about 80 and see what we get. Yep, there's a nice burn right there. So I think we're in pretty good shape in terms of the treatment delivery. You can actually see the blanching the microaneurysms as we go right there. And we can take the evaluation off now so she can do this a little bit better. And we'll go ahead and treat these microaneurysms. So every one of these spots we're applying laser treatment. And it's following her. She's an excellent, she's a wonderful patient. But and some patients aren't quite as compliant, and so you have to follow them around a little bit. So we follow them, but also the eye tracking software follows them as well. So we're just treating individual microaneurysms as we go, staying in focus here. And that takes a little bit of effort here, just a little bit of practice over time. But once you get the hang of it, it's not too bad at all. You can see her blinking. She does not have a contact lens on. And so we're treating the superior microaneurysms right now. Your view is a real image, not an inverted one. And there you can see some of the spots already in. And so we're about half done. You're doing great. And then you can see the no-fly zone that I put in over the nerve and the foveal avascular zone. She actually has some terminal microaneurysms at the edge of the foveal avascular zone that we're going to stay away from. All right, doing great, doing great. Just a few more. You can check your, you can go back to your overlay by clicking on the mouse. Just 3 or 4 more here. And that should be the last one right there. Go ahead and sit back. Great, so that's it. So we applied a total of 96 spots to individual microaneurysms, 80 milliwatts of power, and really was an excellent treatment. Very well tolerated by, certainly by me. I think in many ways this is easier once you get the hang of doing sort of indirect laser. You're looking at a computer screen as opposed to looking through the laser, which takes a little bit of getting used to, but once you do that, I think in many ways it's almost easier. And what was your reaction to that? How was that a particularly difficult procedure? Or I guess it was your first laser, so what'd you think?
It was fine.
It was fine. Good. Okay, so we certainly get it's a fine, and that's a pretty good grade for the first time around. So Dave, any comments? All right, great. One other thing we can do is we can show you how you've got a reporting function. I've done something wrong here. What do I need to do? We do have a reporting mechanism that we can do here. So let me pull her back up and go to report here. And so you end up with, so it'll actually auto-generate a report for you, which is nice. You can add this. You can either scan this into your EMR directly, or you can print it out. And then we can also add. You can also add clinical photos as well. Your treatment plan can go in, as well as really whatever you want to add from the camera. Because keep in mind, this is actually a diagnostic camera as well, so you can perform color fundus photographs as well as angiography.
Awesome. Great job, Lloyd, and it came across really well here. She did a great job. A lot of patients move around and flitter around, but she did a great job. The patients that are used to having a contact lens on their eye can't believe they don't have it on. The doctor who's used to guiding things can't believe this thing really works, but it does. But like Lloyd said, once you get comfortable with it, you really feel compromised. You know, in regular laser photocoagulation, if you were going to hit 96 microaneurysms, you'd probably have at least 96 missed shots with that. I mean, that's if you're good. So here you limit collateral damage to surrounding tissues and hopefully just treat those microaneurysms. You're also treating microaneurysms that you can't see clinically. So only about 1/3 of the microaneurysms that you see on a fluorescein angiogram you can see clinically because of the size. So here we're hitting microaneurysms that are basically only visible on a fluorescein angiography.